The epicenter of Ebola may be Africa, but the aftershocks of anxiety are being felt around the world. According to the World Health Organization, the number of people infected by the virus is now up to 8,000. And the WHO says nearly half of these people have died. For more on this, CCTV's Nathan King joins us live. And Nathan, some pretty shocking numbers here.
That's right. They're so shocking that actually the Ebola outbreak is now being compared to the AIDS epidemic that ravaged Africa during the 1990s and early part of this century. Just listen to the head of the US Centers of Disease Control at a conference here in Washington Thursday.
It's changing quickly, and it's going to be a long fight. I will say that in the 30 years I've been working in public health, the only thing like this has been AIDS. And we have to work now so that this is not the world's next AIDS.
And while the numbers may not be as high as AIDS yet, they are getting worse. And let's just have a look at the effect it's having in West Africa. The sheer scale of the human suffering in West Africa is spelled out in black and white with these new numbers from the World Health Organization. More than 8,000 now infected, 3,865 now dead. The statistics are particularly grim, especially when looking at the rate of new cases over the past 21 days. In Guinea, Liberia and Sierra Leone, nearly 2,800 new infections. That's about a third of all Ebola cases, an indication the virus is spreading at a faster rate than previously thought. And even good news is bad. The World Health Organization says the lower number of cases reported in Liberia is the result of an overwhelmed healthcare system unable to cope with reporting the numbers. As the latest figures were released, the leaders of those three African nations most effective are here in Washington for the International Monetary Fund meetings. And while they are grateful for promises of help, the upward trending Ebola numbers show they need action now.
The general international response has up to this moment been slower than the rate of transmission of the disease. This slower than the virus response needs to change. I hereby seek the acceleration of the translation of commitments to physical facts on the ground. That is what is urgently needed now. Commitments on paper and commitments during meetings are good, but commitments as physical facts on the ground are best.
The most dire need in West Africa is for doctors and nurses. More than 400 healthcare workers have become infected in this outbreak. At least 230 have died. The other need is for hospital beds, according to the latest figures from the WHO. The most affected countries are short of them. Liberia needs 2,300 beds, Sierra Leone nearly 900, and Guinea 50. Without the hospital beds, patients are turned away back into their communities and are much more likely to infect others. And although there have been only a handful of Ebola cases spreading beyond West Africa, governments around the world are ramping up precautionary measures. In Spain, where a nurse contracted Ebola, a doctor who treated her has been quarantined along with 3 others. The nurse's condition has deteriorated. In the US, where one Ebola patient died on Wednesday, another person with the virus is receiving a blood transfusion. Health officials in France and Macedonia are investigating cases of potential infection. In Macedonia, a hotel in the capital of Skopje has been sealed off after a British man died there hours after checking in. He had what authorities call Ebola-like symptoms. And while the spread of the disease outside of West Africa is not certain, governments are not taking any chances. Temperature screenings and other measures are being adopted here in the US, the UK, and other countries are set to follow. But to stop the spread of the disease, it needs to be tackled at its source in West Africa. And the latest figures from the WHO show that is far from happening, Elaine.
And, you know, Nathan, there's been a lot of skepticism with these extra checks because it's all about the timing of catching this virus. So do you think the temperature scanning will work?
Well, let's go back 10 years, shall we? Remember the SARS virus in Asia in 2003? Australian airports screened 1.8 million people during that outbreak. Now, they found 800 people with elevated temperatures, but not one of them had SARS. So it's a needle in a haystack, and the evidence from SARS doesn't suggest this will make much of a difference.
All right, Nathan King, thanks for that update.
Thank you.